breech baby. You can have transverse breech, you can have frank breech, foot, and you get all sorts of presentations. Bottom line, it's just not a normal head down, face left presentation. With the Webster Protocol, what that is, especially with malpositioned babies, it's really something that you don't end up turning babies. Unfortunately, if you look up Webster turning technique, it triggers. And they've really worked at trying to get away from that, because most of the time in the medical community, a turning technique is where you go in, in an emergency sort of situation where if they rupture something, you have an emergency C-section, and it's physically pushing on the mother's abdomen to try to force the baby from whatever position it is to force it to get it head down. It's traumatic. It's tough. And that turning technique, when you say, well, chiropractor did this turning thing on me, they go, what? They light up. It's like, well, no, don't even touch the baby. It's a process of the mother, because what happens is with the pelvis, the first page in there, it shows the ligaments. You have the broad ligament and the round ligament that attaches to the soft structures of the uterus, attaches to the hard structure of the pelvis, right? Yes, sir.
There's a picture there.
Right there. And I gave one to them. And so you have the attachment of the sacrum, and then from the round ligaments down to, and it's interesting, they have it actually going to the soft, they actually have the fat pad in here in front. It's actually at the sacrum, the pubic bone. So it's attached to the hard structure. So what happens, if you get a misalignment of the pelvis, the sacrum, the pubic bone, the soft structures go along with the hard structures, and it creates an area of stress. Well, the baby's most vital thing, first thing that grows on a baby, is the brain. It should be head down. Well, the baby goes, I'm not going there, so it'll get the head out of that area of stress. So what happens is that those malpositioned babies, is the baby really protecting itself from the stress in the structure of the mom. So the Webster Protocol is adjusting the mother's sacrum and then working on these round ligaments to reduce the stress. When you reduce the stress, the baby goes, I can do that. That's why mom says it's almost instantaneous. You reduce the stress, baby goes head down, and they're then able to come out head down. I've been doing the Webster stuff for 20 years. I've had maybe a handful that haven't turned. I've also had one that for no known reason we can figure out. She was under care with me. We were checking for it. Baby went malposition. Nothing would change it. She delivered. There was no cord wrap. There was no other apparent reason. The placenta wasn't misplaced. We have no idea why it was. It's really the only one that in all the time because typically if a baby doesn't revert when you do the Webster Protocol, it's usually either a cord wrap on the neck, a short umbilical cord, where the baby is just they're protecting themselves for whatever reason. So that is really the whole idea of the Webster Protocol. And so if you ever, just plug it in your brain. If you're ever talking and say, oh, my baby's malpositioned, or we're talking about doing an external version, which is that turning protocol, tell them, wait. Give a chiropractor a chance. Do that first, and get the mother normalized, because then what that does is also set the mom up for a better labor and delivery after that. That makes sense?